Todd Thoughton here from Thoughton Physical Therapy and Sports Conditioning in Attleboro, Massachusetts for another exciting episode of Facebook Live, number 66. This is the third in a series of core activation, principle and core activation exercises as opposed to stretching and other things that we may try and do. My belief is that core activation is everything. So in this episode, it's going to be, again, Facebook Live number 66, phase 2 of core activation. These are going to be the top 6 exercises that are going to be good for you to get rid of that lingering neck, shoulder, back, leg pain for good. So in this episode, you're going to learn how to do the correct core exercises and continue to progress along and make them part of your daily routine. Not just showing exercises lying down on your back, but how do you progress them from lying down to sitting, to standing, to moving, and then movement patterns. So who am I? Again, Todd Thoughton here from Attleboro, Massachusetts, and I am fascinated with the correct core activation exercises are crucial to rehabbing and preventing any injury that you have. I beta tested over 15,000 patients over the past 5 years, and I can say with 100% certainty, all upper body injuries are related to the neck. Shoulder, elbow, wrist injuries are all related to the neck. All low back injuries, low back, hip, knee, ankle, plantar fascia, all those injuries are related to the lumbar spine, low back, and the hips. My belief is also that all injuries are caused and all injuries are predictable and preventable. So what is the difference between activation and stabilization? In my opinion, activation is when we're able to activate individually the muscle group that we're trying to fire. Now, for example, when we go to activate the glutes, most people, when they go to activate the glutes, they're activating the lumbar spine extensors, and they're activating the hamstring, which is why people have hamstring and low back pain, because they can't differentiate them. So in order to activate them, we need to activate them separately. Another example, for example, we just talked about glute activation, is transverse abdominis activation. When most people go to activate their abdominal muscles, they activate every other muscle, including their pelvis, their glutes, their hamstrings, instead of just the transverse abdominis muscle. We need to find your correct starting point. Stabilization is when we can do the sustained activation through movement and then through movement patterns. Crucial. So activation and stabilization. So last week we talked about my top core exercises to develop your true starting point to rehab you or to start an exercise program or to just start feeling better. Number 1, diaphragmatic breathing. Number 2, chin, tuck, scap, squeeze together. Again, all these are on your back. Number 3 is a transverse abdominis set, which is when we take your belly button to the spine. Number 4 is the hip adductor squeeze with the ball at your groin, not at your knees, not at your mid-thighs, as close to your groin as you can, because we really want to get those adductors fired. Number 5 is the prone glute squeeze, and separately, individualized prone glute squeeze. And number 6 is the prone upper trunk extension, or as well as prone hip extension. Number 1, diaphragmatic breathing. We need to be able to take it from a lying down, then to a sitting, then to walking, then to running, then to riding a bike. So basically, diaphragmatic breathing with movement. Number 2, chin tuck, scap stability exercises. So we're going to progress the chin tuck, just the chin tuck lying down, chin tuck seated, chin tuck standing. Now we're going to progress it to 3 times 1 minute intervals of chin tuck head lift. Again, we want to stabilize the cervical spine. In the core, if we stabilize the cervical spine, the fuse box, then we're going to have strength to the rest of the body. Then we want to progress to finding your starting point and what is the best position for the chin tuck and scap squeeze, like I said, in sitting, then in standing, then in walking, and then during movement and movement patterns. Number 3, transverse abdominis set. So we take our transverse abdominis set lying down to holding the transverse abdominis muscle, belly button to spine while you're breathing, then while you're moving. What can moving be? Well, we'll do it sitting, then we can do it while we're standing, while we're talking to other people, while we're hanging out having a conversation, while we're shopping, while we're driving. Then we want to take it when we're walking, when we're bike riding, when we're running and exercising. We want to do this eventually all the time so the transverse abdominis is turned on all the time. Number 4, we progress the hip adductor glute squeeze to a bridge, to holding in a bridge position and do a pulsing motion. Again, inner thighs. We do our Kegels, we do our adductor squeeze, we do our transverse abdominal ascent with your bottom up in the air. Then we can do also holding Todd squat with the 3 different positions, with the ball above your knee, the ball below your knee now, and the ball at your ankles, in which we glide and hinge at the hips first, because we want to initiate the glutes first. Then we progress to side stepping with the ball in our upper thighs towards the groin, and we do a side stepping motion like you see people do with a band around their ankles, but we want to get adduction. Your adductor muscles are your shock absorbers, crucial muscle that people do not work. Then we progress from the prone glute squeeze, working the glute muscles, to hip hinge with a piece of PVC, then hip hinge to a squat, then the Todd squat, which is the ball between the knees, hip hinge backwards, big toe and arches down, and we move from the pelvis first, bend the knee second. And the number 6 exercise is going to be we're going to progress to the prone upper trunk extension with a pillow underneath our hips, and then to a Bosu. Then we can also progress to, since they're separate, we can progress to upper body and lower body together as well. Please let me know. Please feel free to tag a friend or family member. Please feel free to share this video. We'd like to spread the word as much as possible why core activation is everything. Again, thanks for tuning in. Facebook Live number 66. Have a good night.